All right, we're live. Nithyananda, welcome back to Nithya Kriya every Wednesday. So today is the 24th of May, and today we're going to have a Kriya called Nithya Kriya Care for Irritable Bowel Syndrome. So before we enter into the session improper, let's prepare ourselves, center ourselves for a few minutes, and invoke Swamiji, our beloved Guru, to the space. So sit with the back straight in any comfortable meditative posture, whether Sukhasana, Padmasana, any comfortable meditative posture with the back straight, head, neck and spine aligned, one straight line. I'd like you to close your eyes and become aware fully of this physical body from head to the toes, your fingertips. Be physically present in this body, and then expand your awareness to encompass your breathing. So start breathing very slowly and deeply. Enter into a gap, a pause, a neutral zone. Then you exhale very slowly and completely. At the end of the exhalation, you enter into the second gap, second neutral zone. So go on breathing in this manner with awareness of the two gaps between the incoming breath and outgoing breath and incoming breath. Understand the gap is where there's no thought, no movement, just silence. So let's tune yourself to the Shiva consciousness in that silence. And come to the space of listening, Shravana, ready to receive what Swamiji has to impart in this Nithya Kriya, care for irritable bowel syndrome. With expanded awareness, let's invoke him. I'd like you to join the palms together in Amajali Mudra and place it in front of your Anahata Chakra, your heart center. Let's chant the Saguru Vandanam together, followed by 3 times the Mahavakya. Take a deep breath. Nithyanandam Paramasukaram Kevalam Jnanamutim Dvandvatitam Gaganashatrisham Tattvamasyarilaksham Ekam Nityam Vimalamachalam Savadi Sakshibhutam Bhavatitam Trigunarahitam Satguruntam Namami. Om Nithyananda Paramashivam. Om Nithyananda Paramashivam. Om Nithyananda Paramashivam. All right. A very warm welcome to all of you once again, those people who are joining me on the Zoom, as well as the social media platform. So we're now live. Welcome to all of you to this session, Nithya Kriya, care for IBS, Irritable Bowel Syndrome. So now I'm just going to quickly sail through this because every week I've introduced Nithya Kriya. But I'm going to do a quick summary so that you don't have to hear the same thing again and again. You can read the text if you want. Okay, so basically, what is Nithya Kriya? Is a unique combination of components of Nityananda Yoga, which include asana, yoga asanas, posture, pranayama, the breathing technique, certain visualization, both external verbalization like mantras, and internal verbalization, like certain internal hearing sound. So these are the unique combination of each Nithya Kriya. So these Kriyas are derived from the ancient source of scriptures of Hinduism, and they're decoded by the Supreme Pontiff of Hinduism, His Divine Holiness Bhagavan Nithyananda Paramashivam. So he has done this over a span of 18 years. And this is the outcome of the gift that he has blessed the world in 2011. Okay, so now let's look at what are the Kriyas. More details about the Kriyas. Next slide. So basically, Nithya Kriyas, they preserve and deliver the original yogic practices which are born out of millennia of research and development and other contribution of innumerable enlightened yogis who have dedicated their lives to enriching the world with this science. So understand that a lot of techniques or breathing techniques given in the Kriyas are actually done by the, a lot of enlightened yogis. And they include people like the legendary yogis, include Goraknath, Matsyendranath. They are from the Natha Sampradayas. They are one of the earliest enlightened beings who contributed a lot to the science of pranayama and kriyas. Okay, so next slide. So understand one thing. The constant flow of energy happening in our body, okay, through the certain energy channels called nadis. There are 72,000 nadis in our human body. And that forms the energy circuit, the Kundalini energy circuit. See, Swami said that in our body there are 7 circuits. And one of the circuit is Kundalini energy circuit. Okay. So why you need to know this Kundalini circuit? Because it works on the more subtle dimension of our body. See, our body has got 3 aspects. One is the physical body, which is the flesh and bone that we are carrying now, where you can see, touch, and feel. Then the second body is called the subtle body. So the physical body is called Stula Sharira. The subtle body is called Sukshma Sharira. They encompass, the chakras, the nadis, the energy channels. Okay. Then the third body is called a Karana Sharira. Okay, which is the causal body, where the consciousness resides. Okay, where the consciousness is reflection of the consciousness. So these 3 bodies, they are important because these 3 bodies, the intersection point of these 3 bodies is what you call as chakras, the energy centers. Okay, so whenever there are certain disturbances in, let's say the Sukshma Sharira or the physical body, you will create a physical ailment or diseases or disorder. Okay, so here Swamiji is reviving the science of using the Kundalini energy, which is the immense potential energy that everyone has present in each one of the body, to act as water pump and help complete this energy circuit. See, the Kundalini Shakti is the inner potential energy for awakening, right? And you can also use this energy for healing, to get back to, the healthy state. So a lot of these kriyas are very powerful technique to awaken the Kundalini Shakti, the inner potential energy. And Kundalini can be thought as everyone's hotline to infinite cosmic energy source. Basically, when you awaken the Kundalini Shakti, it means what? You have touched the source of the cosmic energy. And once it is awakened by appropriate yogic practices and guidance and grace of the Guru, which is Swamiji, the Kundalini energy showers a host of blessing on the practitioner itself, not just energy level boosted, physical well-being, falling away of negative mental patterns, feeling inner fulfillment, and this deep feeling connection with the universal source, Paramashivam. So it has got so many benefits. And whenever there is a disturbance in this energy flow in some parts of our body, which impedes the energy flow to the rest of the body, resulting on the onset diseases, disorder, disturbances in the body. That's how we manifested physical diseases, chronic diseases, or cancer, anything of those in the physical body, but it all begins first in the disturbances of the energy flow, which comes from your mental layer. Okay, so Nithya Kriyas, they are actually powerful tools which help remove these energy blockages. See, when you live a lifestyle that is not aligned to the truth, or the natural way of how the body wants to exist, like you're dumping a lot of toxic in the body through the unhealthy lifestyle, be very clear, it naturally is going to create energy blocks, right? So which means that the flow of the prana shakti, the life force in the body, is not aligned. Okay, so with these kriyas, it helps to remove these blockages and also realign the whole body back to its original state, to allow the kundalini energy to flow freely again as before. So that is essentially the science of Nithya Kriyas, which is awakening the kundalini shakti. Next slide. So understand that if you allow your body to do what you're supposed to do, then you're considered healthy. See, this is Swamiji's one definition of health, right? That means what? You can do whatever you want. That means you're healthy to do whatever you want. And not only that, when he talk about optimal health, means that even the possibility of disease happening is not there. That is considered health. So understand health from the Vedic context, from the Sanatana Hindu Dharma. Okay, it is all about aligning your body to your purpose. That is health, right? We all want to be healthy. Nobody wants to be sick. So your idea about health needs to be established based on the cosmic principle, aligned to the cosmic truth, not from your own cognition or from the society's definition. So that's essentially what we need to know, that for overall good health and well-being, this tradition, Hinduism, has many solutions that can be easily practiced and incorporated in our daily life. If you know the science, if you know how to use it, you know how, it can be facilitated by acharyas to help you incorporate that into your life, and a lot of things can be healed. You don't need to waste a lot of time or spend a lot of resources on unnecessarily for complicated, very invasive treatment. So that is one of the great benefits if you know how to use some of these yogic techniques to heal yourself. Next slide. All right. So how are all these kriyas, where are they rooted? Understand that they're rooted from a lot of yogic scriptural references, the yoga scriptures, including Yoga Sutra Patanjali, Hatha Yoga Pratipika, Dhirendra Samhita, and Shiva Samhita. Next slide. So these are the four main scriptural roots of Nithya Kriyas. Next slide again. So there are also other scriptural references that Swamiji draws upon. They include Kumbhaka Patati, and then also Trishikbi Brahma Upanishad, Yoga Kundale Upanishad, Yoga Chantamani Upanishad, Yoga Taravali, Yoga Pratipika, and Yogasana Mala Sachitra. Okay, so these are some other additional references on top of the four mentioned earlier. So essentially understand that Swamiji has gifted 108 Nithya Kriyas to humanity, which include a combination of care and cure, okay, for different modern ailments or diseases that we are facing today. So he's giving this as a solution, and a lot of these self-administered healing techniques can be used to essentially help yourself to heal your body. So this, we call it the gift from the superconsciousness, which is established from the enlightened consciousness where Swamiji is radiating continuously. So with that context, let us bow down and give our gratitude to Swamiji for sharing this sacred knowledge to humanity. Okay, so understand over the years, this Nithya Kriya has helped many people and also make extraordinary progress in recognizing, diagnosing, and treating mental illnesses, including the severe psychological distress, whether it's depression, anxiety, we call it post-traumatic stress disorder. Many of these kind of mental related or psychological related disorder. These Nithya Kriyas are really, really powerful and able to, heal them completely. So understand it is the policy of Kailasa Department of Health to work towards the unified goal of bringing excellence to the healthcare provision to the citizen of Kailasa, by providing all of us with the best services towards well-being so that we can achieve success, prosperity, and ultimately also contribute back to the world. So this is what Swamiji wants us to do. Those who are unwell, get back to well-being through these kriyas and then come back and contribute. All right, so that is the initial setup for the Nithya Kriyas, which I tried to do a quick summary. Now, let's enter into the subject matter. Nithya Kriya care for IBS. So here's some disclaimer, once again, just to iterate, especially for the new people who have not heard about this, they are doing it for the first time. So understand a few things. One, the flow of Nithya Kriyas is a continuous process. So you need to follow the steps because it has been designed step 1, step 2, step 3, step 4, step 5, whatever the step organized, you need to follow the steps as it is outlined. You cannot say, I do step 1 and 2, I skip 3 and 4, and then I'll do the last step. No, you have to do all the steps as given as the solution. Okay, so this is the first thing. Don't cherry pick what you like and what you dislike. Do the entire continuous steps. Second, do not break in between until the entire segment of the kriyas is officially completed. Okay, there's no such thing as I do part 1 and 2 this morning, 3, 4, 5, I do it in the evening. No, you do it one shot. If you dedicate the time, half an hour to do this kriya, finish all the steps, and then you go. You cannot break the steps and do it in different time of the day. Okay? Do it as an entire segment. So this is the second important thing you need to take note. And also the third thing, the following kriyas all the kriyas are recommended to practice for at least 21 days, because Swamiji has said that our body develop a new habit or new muscle memory if you practice certain thing 21 days. Okay, no break in between. Okay, so continuous 21 days. If you do it repeatedly, you will have that as part of you, a habit. So that's why Nithya Kriyas we recommend at least 21 days. If you like to increase more to get the desired result, you can do it 42 days, 2 cycle. That means 2 times 21 days. Okay, so that is also possible, but minimum 21 days. And then the next thing is, the technique is not intended to substitute for professional medical diagnosis or treatment. Understand? This technique is, you need to consult your medical, healthcare provider. If you want to practice some of these prayer, like if you have certain medical condition of the elderly and you are for children below 14 and women who are pregnant or suspect they may be pregnant. So it is best to seek the professional advice before you start practicing these techniques. Okay, so these are the disclaimer. So the other thing that viewers who are not on two-way video and they're just listening and trying to practice on your own, please, you're practicing at your own risk. So it's best that I can see you, then we can also have that interaction to advise you if you have any question. All right. Great. So now let's understand a little bit of this thing called irritable bowel syndrome. Understand? IBS in short. This is the acronym for irritable bowel syndrome. It is also known as the spastic colon. Spastic colon. It is a symptom related to symptom-based diagnosis. So what it means is that the syndrome is characterized by chronic abdominal pain, discomfort, bloating, and alteration of bowel habits. Okay, so listen very carefully. These are the symptoms of this IBS. One, chronic abdominal pain. That means having pain in the stomach, feeling discomfort due to bloating, and also, the bowel movement is not smooth, or it could be diarrhea, it could be having constipation, something related to this alteration of bowel habits. Okay, so IBS is a functional bowel disorder. Be very clear. It means what? The discharge of the waste is disturbed. So there is no known organic cause. There's no in the medical field. This is what extracted from the medical field. They do not know what is the organic cause, whether it's constipation or diarrhea. All this may predominate or may alternate. There be a period that the person suffering with IBS may be having constipation, and sometimes over a period the person may be having diarrhea. So basically, the diagnosis of IBS can now be made on the basis of symptoms alone. They can only know to observe the symptoms, and they classify this disorder. Okay, in the absence of alarm features like the age of the onset greater than 50. See, this disorder is very more prominent or predominant in the older people, and there's a systematic signs of infection, colitis, and also certain weight loss or family history of inflammatory bowel disease. So basically, if your family have a history of inflammatory bowel disorder, so you may be very prone to have this kind of condition as well. Infection in the gut itself from the mouth to the other end. Okay, and if you're older. So these are some of the what I call that, people who have this kind of symptoms may develop into IBS. Okay, so onset of IBS is more likely to occur after the onset of a stressful life event. Okay, if you have gone through a very stressful life event, let's say loss of someone, or you have gone through a very traumatic experience, or after an infection. For instance, you had a bad bowel infection due to certain sickness. Let's say you fell ill and you had a bad infection, okay, which nearly caused your death or whatever. So, all this create a lot of disturbance in the whole, stressed in the whole gut, in your whole digestive system, which may in turn create problem in the digestion. Okay, so there is no cure for IBS. There are treatments that attempt to relieve the symptoms, like medication, dietary adjustment, psychological intervention. So this is what the medical is saying. Okay, so next slide. Now, understand, patient education and developing a good doctor-patient relationship are also very important for understanding how to improve the condition. So IBS can present as several other conditions. They include inflammatory bowel diseases, okay, celiac disease, fructose malabsorption, malinfection, parasitic infection, okay, bowel acid absorption, malabsorption, functional chronic constipation, and chronic functional abdominal pain. So these are all related to the digestive system, okay? And in next slide, sorry, you turned to, you went back to, this is the earliest slide, is it?
Did I go back to the earlier slide?
No, go to the next slide. Yeah, I was in this slide and you.
Oh, okay.
Yeah, go back to the last slide. Okay, so this is the slide. All right, so I'm just saying that. So routine clinical tests yield no abnormalities in IBS, although bowel may be more sensitive to certain stimuli, such as, they call the balloon insufflation testing. So these are all medical terms, okay? So the exact cause of IBS is unknown as of now to the medical field. The modern doctors or modern medicine do not have the exact cause of IBS, although there may be abnormalities in the gut flora and the immune system. The most common theory is that IBS is a disorder of interaction between the brain and the gastrointestinal tract. So it means the disturbed mind creating a disturbed, gut. So that is what they can establish only. Okay, but obviously there are more to it when you come to the yogic science, where they can see the cause of this disturbance, right? So that's why. So IBS is a source of chronic pain, fatigue, and other symptoms, but it is not shown to have an effect on life expectancy. So the disorder contributes to work exceptionism. That means when you're having this problem, you tend to not able to work normally. So that affects the quality of life. So having IBS affects the quality of life. That means, like, imagine you have stomach ache halfway through the working hours, or you're in the midst of an important meeting or presentation, and then suddenly you have this chronic IBS, which is not very nice, right? So it can affect the routine. So in the world today, let's look at some statistic. This is taken from the source, okay, grandviewresearch.com industry analysis on IBS. Okay, so this is the thing. You see, IBS is twice as common in women as in men, which means what? Women tends to worry so much more and get stressed out more. That's why they have more. They're more prone to IBS. So it means what? 1 in 3 people in UK say they suffer from IBS. Oh God! So in UK, the people, that means what? At least the 33% in the population have IBS. That's very, very high. So in UK, the IBS sufferer takes an average of 9 days off work per year. Okay, so it means out of, let's say you work how many days per year, right? Not 365 days. You minus off the weekend. Let's say you work, let's say 200 days. I'm just saying. And then at least there will be 9 days you'll be off work because of IBS. So 6 in 10 sufferers are never sought professional help. So that means what? Like 60% of people who suffer from IBS, they never quite go and find professional help to get out of this or be healed completely. So that is the statistic. Okay. So any questions so far before we enter into the practice itself? You can type on the chat if you want to know, if you have any questions. Okay. So if there's no question, let me just proceed with the steps for care for IBS, okay, Irritable Bowel Syndrome. So actually this IBS Nithya Kriya is quite short. It's only 4 steps, okay, only 4 steps. And so I'm going to describe the 4 steps now. Then we'll go through it step by step, okay? So the 4 steps to follow are, first, this Kriya, the posture that you're going to assume is the first Karana of Shiva Tandava. You know, Shiva Dandava is Shiva when he does the cosmic dance. This is the first posture that he's established. is actually called Aramandi. Okay, so we will do that later on. So throughout the other 3 steps, that means throughout the whole Kriya, you're going to be standing in this Karana, Aramandi. Okay, in this Karana, you'll be doing Vastrikra, Uddiyana Bandha, and Trishula Kumbhaka. Okay, so let's get into the first step, which is come to the posture of Shivatandava Karana Aramandi. So I'm going to stand now. So all of you who want to practice with me, please do it. Okay. So I'm going to read through the steps first before we do it. Okay, together. So first thing, the posture is called Aramandi. So your weight should be on your thigh. That means you should be standing in such a way. Okay, legs apart. Okay, and bend the legs slightly so that you release the weight into the earth. You are connected to the earth. Okay, not with the knee straightened, but bend so that you feel like you can relax into the Mother Earth. So there is a feeling connection with the earth. Okay, so this, and hold the hands in this mudra. Okay, so the top right hand is below the palm, so it's like this. So right palm on top of the left palm, and you're supposed to bend and put it in front of your Anaragandha, so which is near the solar plexus area. So Anaragandha is between heart chakra and the navel chakra. Okay, so this is a spot where all the 7 chakra merges into that one spot. Is called Anandagandha. Okay, so this is the posture. So now let's stay here first for like a few 30 seconds just to get comfortable. Okay, so you're going to breathe and exhale. As you exhale, bend slightly, and you again inhale, breathe. Feel the elongation of the spine and exhale. So just breathe. Give yourself about 30 seconds to get used to this posture, this Karana Aramandi. Okay, with a palm in front of your Anandagandha. Feel comfortable. You can feel there's a lot of activation of the strengthening of the thigh muscle because you're holding the weight on the thigh. You'll feel, if you have not trained in yoga, you feel the thigh can get a bit tiring. Okay, but let's continue. All right, next step is the Vastrika Kumbhaka. Next, so let me just describe the instruction, then we do it. Okay, so listen. You're going to rapidly inhale and exhale like the bellow of the blacksmith. Okay, as you breathe in and out till you become tired, fatigued. Okay, and then so you're going to breathe after you have done this first part of this second step. Then you're going to inhale through the right nostril, then press the chin down, lock the Jarata Bandha, okay? Till you can't hold anymore, you release through the left nostril. Okay, inhale through the right, lock it, and exhale left. Okay. Now, after that, you stand straight up and put a hand on the hip. Okay, and then try to come back to the same posture. So you're supposed to do this 3 times. Okay, so let me just guide you through that first. So in this posture, all right, Aramandi, we do the Vastrika. Okay. So now I feel that I'm fatigued now after so many pump. So now after that, I'm going to inhale through the right nostril, hold and lock the chin as long as I can, judicially, comfortably. Then when I come, I exhale through the left nostril. Then after that, I stand straight Okay, and put the hands on the hip. The hands on the hip. Okay, and now come back to the same posture. Okay, so this is one round. We're going to do 2 more rounds because he said practice this step 2 3 times. Okay, so let's do it now. So now inhale through the right nostril, hold and lock the chin down, lock the throat, release and exhale through the left. Then put the hands on the hip. Okay, stand and straighten and put the hands on the hip. Just stay there for a while. And feel the Kundalini energy of getting awakened. Alright, let's begin now. The third time. Okay, ready? Come back to the same posture again, which is Ardha Bandhi. Let's start. Alright, inhale through the right nostril. Hold and lock the chin. Release the chin and exhale through the left. Put the hands on the hip, straighten up. Just breathe normally for a while. Alright, so now let's go to third step, okay? Uddiyana Bandha, internal seal. Let's go to the instructions. So, this one, from Ardha Bandhi, you're going to come into this posture. Half bend, your torso is bent forward. So, let me go through the step first, okay? The instruction for the technique. Then we do it together. You need to understand first. Sorry, this is taken from the Shastra Pramana. I forgot to. It's Yoga, Chitto Upanishad, 106 to 109. Okay, so now let me just read the Akashic reading. It says, Uddiyana Bandha should be performed at the close of the Kumbhaka and before the Vikaka, the expulsion of the vital air, which is exhalation, for the reason that by such bandha, the prana, vital air, would spring out in the Sushumna. The central nadi is the Sushumna. That is said to be what is called Uddiyana by the yogis, right? So Uddiyana is always communicated by the Guru in the natural cause. The practitioner, the yoga practitioner, should practice it without sloth, it means without laziness, whereupon even an old man would turn young. So when you do the Uddiyana Bandha, you anti-age, he said turn young. He should with effort make constriction above and below the navel, and should be practiced it for 6 months. He will invariably conquer death. There is no doubt about it. So this is the Shastra Pramana for the third step. Sorry, Parameshwari, can you go to the second step? I want to read the Shastra Pramana. I missed it, sorry. I missed the Shastra Pramana. Okay, so let me just read the Shastra Pramana for the Strika Kumbhaka. It's taken based after Pramana. It's from Kumbhaka Paradi, verse 164 and 165. It says, one should exhale and inhale like a barrel of the blacksmith until fatigue sets in. Then he should repeat rapidly. Exhale through the right nostril, Inhale through the right nostril and exhale through the left. After holding the breath, performing Jalanta Bandha. This is Vasrika Kumbhaka. Okay, so which I just wanted to retry. Okay, come, let's go back to step 3. This is the thing. So you're supposed to stand for Aramandi, but with a, with the torso now bent forward. Okay, so he said bend the knees slightly and rest your palm above the knee with the thumbs facing inwards and the other 4 fingers outwards. So it's like this. My other 4 fingers is outside and the thumb is inside downwards. Okay, so this is the posture. Assume and keep the spine straight. Don't round the back or slouch. Just keep the spine straight in its natural curves. So the head should be up and eyes open. Okay, head should be up and eyes open. Okay, take a deep breath and exhale completely. Do not be forceful. Okay, so we take a deep breath. After exhaling, move the chin down to the chest. That means Jalanta Bandha and raising the shoulder. Okay, then pull the abdominal muscle inwards so that the organs in the abdomen touches the back of the muscle. Okay, so understand? I think next slide there's still some more instruction. Okay, so you're supposed to hold as long as you can till you can't hold anymore. Okay, till you can't hold anymore before inhaling. Relax the stomach, abdomen, and raise the head and stand straight. Okay, so this is what you do. Okay, then inhale through the nostril slowly. After you stand straight, you're supposed to inhale through the nostril slowly before repeating another round. So you breathe normally for about a minute or 2. Then he says initially start this whole step, this Uddiyana Bandha, 3 times minimum. Then gradually increase to 10 times. Okay, so today we'll do 3 times. We'll not do 10 because some of you may not be able to take it. It's quite intense yogic practice. So I'll do 3 times with all of you first. And once you finish, you can be seated in the 4th step. Okay, so let me just go through it step by step with all of you. This step 3 has a lot of instructions, so you need to listen very carefully. So come into this posture. Okay, so all outer 4 fingers facing out, and the thumb is facing downwards. Okay, inwards down. Okay, now keep the spine straight. Okay, with the head up. Don't look down. Head up, so that your neck is its natural curve. Eyes open. Now take a deep breath in. Then exhale completely. After exhalation, tuck the chin down and suck the whole abdominal muscle in the organ, tuck against the spine. Next slide. So you can't hold anymore. Just relax the abdomen and relax everything and start inhaling and straighten up. Okay. So then stay here and breathe 1 minute normally. So just stay and breathe slowly for 1 minute, normal breathing. Because the whole Uddiyana Bandha is quite intense. So just stay there for 1 minute. All right, let's do round number 2. Come back down again in this posture. Okay, look forward with the eyes open. Now take a deep breath and exhale completely. After exhalation, tuck the chin down and draw the abdominal muscle inward. Hold. Release. Then straighten up. And again, stand for 1 minute and breathe just normally. All right, let's do the third round. Okay, go back. Again, let's inhale very slowly and exhale completely. Tuck the chin and activate the Uddiyana Bandha. Jalanta Bandha and Uddiyana Bandha, both are activated. Stay. Hold the posture. So when you're standing, you feel the Kundalini getting awakened. Just allow it to happen. When you're standing for that 1 minute, just breathe normally. When you're standing in this posture, you're still in Aramandi. That means the knees are bent, but the torso is straightened. All right, now we go to the step number 4. We'll sit on the floor now. The last step is Trishula Kumbhaka. This is something we've done before in previous some other kriyas, but let me describe the after pramana, the source of where this knowledge comes from. It's called Kumbhaka Patati, verse 193. In our Akashic reading, it says one should always inhale through both nostril and the mouth simultaneously and hold the breath before exhalation. This is called Trishula Kumbhaka by Shiva, which removes all the 3 folds of suffering. Okay, so let me go through the technique itself. So you can sit in Padmasana if you can, which is what I'm doing now. And in a seated position, inhale through the nostril and the mouth simultaneously. Then hold the breath judicially. Till you can't hold anymore, exhale only through the nostril and relax. So we'll do this 7 minutes. So I'm going to put on a timer now. Okay, I'm going to put a clock timer for all of us to practice. So you ready? Let me just repeat one more time the instruction. Come seated in any comfortable meditative posture. You're going to inhale through the 3 holes, the nostrils and the mouth together, like this. Okay, hold it as long as you can, feel comfortable. Till you cannot hold anymore, release by the exhalation through the nostril. Okay, let's do it now, 7 minutes. Okay, start. All right, relax. Finish the last round and relax. You can unshare now. Just sit for a few minutes after the whole Kriya. So I'm just going to sit and play some music. Okay. So you just basically sit and enjoy the music for a few minutes. Okay. All right, relax. You can slowly open your eyes now. Oh my God, very powerful Kriya. Huh? How do you feel? Anyone who experienced it? Very calming. When I sat after the whole 4 steps, really, very calming. There's no thought. You want to share on the chat? What do you think about this Kriya? Very short Kriya only, but very powerful. So have a look. See what anyone want to share. I couldn't stop getting awakened. Thank you, Swamiji. How do you feel about this Kriya? Hey, understand, I'm telling you, okay? This is my experience. Many of these Kriyas, seemingly things that, oh, you only have to do it only when you have this problem. No. Yeah, understand. See, one thing good to learn about this Kriya is to prevent you, that's why it's called care, preventive care. Prevent you, and in old age, you will have IBS, okay? It's a preventive Kriya, okay? So now, the next thing is, if you have old folks, people at home who have this IBS, right? When you're old, you tend to have digestive problem, right? Either too much bloatedness or diarrhea, all this kind of thing. This is one Kriya we can teach them, okay? So knowing this Kriya to teach them is a good thing, okay? That you can enrich your family. Now, the next thing I also find, see, I realized that when I, for the last, I would say, maybe more than 6 months now, I started in September. More than 6 months, I've been working on different Kriyas, right? And I started to become aware, like certain breathing technique like works on different organs, okay? Like certain pranayama helps to work on certain organ, okay? Like in this case, or the whatever that is prescribed here, like the Uddiyana Bandha and the Jaranta Bandha, they work on very much on the gut, the digestive tract, okay? And that is something that I starting to see, like there's certain kind of pattern in the different breathing techniques. So it's quite interesting to see how different pranayama works on different internal organ of our body. So that's, of course, I'm continue trying to explore more and see what comes out. But I'm seeing like there are certain like from the scriptures, when they describe, it gives me some kind of understanding about that breathing technique. Okay, so Charashadika says that the eyes cleanses thoroughly like being washed. Yeah. Okay, you got tears in your eyes, huh? Is it? Yeah, tears. Okay, what about Rosita? What's your experience?
I used to have the IBS many years before I became vegan.
Okay. So that's why do this. And how was it when you practice this Kriya?
Yeah, the step 3 and step 4 are very powerful. I can feel some funny feelings in the stomach.
Yeah, that's a lot happening in the gut, right?
Yes.
Okay. So, you can continue to practice for 21 days and see what it does for you, because, when you had IBS in the past, this is a time to use the Kundalini Shakti to completely wipe out the muscle memory. See, when you have certain disorder, it's recorded in your muscle memory, okay? So maybe sometimes you go through certain stressful moment in your life, again, you may trigger the same disorder. So take this opportunity now that, after you become vegan, that the occurrence of this is gone away, maybe certain food you're allergic to or whatever, but do this like a cleansing to reprogram your muscle memory, okay? So this will be my advice, and then you'll be completely bye-bye to IBS. Don't come and visit me anymore. Bye-bye. A good farewell to IBS. All right. So with that, hey, Parameshwar, do you practice also? Or you just only have the slide, you didn't practice?
No lah, I was looking at the slide. Very hard to
Do and then. Okay. All right. That's fair enough. So thank you for helping me to show the slide. So with that, let's conclude now. If there's no further question, and we'll wrap up with the Puna mantra. So let's join the palms together in deep gratitude to Swamiji for gifting us so many wonderful sciences from the yogic technology to heal many of the common ailments in the society. So let's end with the Puna mantra. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vashishyate. Om Shanti 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 Hari Om Tat Sat Sauvam Bhagavat Nithyananda Paramashiva Parga Paramastu. Om Nithyanandam. All right, Nithyanandam. Thank you. You can stop now.